These are obviously injuries that have had huge military consequences in the past. I mean, just for some of the numbers, Napoleon in 1812 invaded Russia with 250,000 effective troops, came back with 350 effective out of that 250,000. A lot of that was hypothermia, but a significant number of those were also frostbite and non-freezing cold injuries. During the Russian-German conflict in World War II, just in November and December of 1942, the Germans alone had to do 15,000 amputations for frostbite. The Italian invasion of Greece in 1940, in just 1 month, they had 13,000 cases of frostbite. And for the U.S., we've had literally tens of thousands of frostbite and trench foot injuries when you combine World War I, World War II, and the Korean Wars. Fortunately, we haven't seen much of these injuries recently. Really, the last conflict that had amputations and a significant frostbite was really, trench foot, non-freezing cold injury was the Falklands conflict, which in review is almost 40 years ago now. Fortunately, with most of our conflicts now, we've been able to prevent most of those. Probably the first thing I should go over is prevention, because all of these, you can treat them, but prevention is the most important thing you can do. There's a couple of basic guidelines. Number one is stay warm. Protect yourself from the environment. So stay protected from the wind, have enough insulation. And people often ask, well, where's the risk? Well, anytime it's below freezing or below freezing, you're at risk for frostbite. Temperatures below 60 degrees, you're at risk of non-freezing cold injury or trench foot. But when we talk about frostbite, particularly once you start getting to temperatures of 15 below or lower, you're really at extreme risk of frostbite. And that can be kind of a combination of actual temperature as well as wind chill. Now, again, wind chill is only going to affect tissue that's not covered by anything. So as long as you protect yourself from wind with some sort of covering, then you don't have to worry as much about wind chill. First thing to know is the gold standard for treatment of frostbite is rapid rewarming in warm water. That's going to give you the best outcome for somebody that has a frostbite injury. Now, this is where there's been some changes in just basically the last couple years. So the gold standard recommendation now on all the civilian guidelines is rapid rewarming at water that's 37 to 39 degrees centigrade. So that's essentially 99 degrees Fahrenheit to 102.2 degrees Fahrenheit. All the guidelines used to say go with 40 to 42, so 104 to 108 degrees, and you can still use that. The difference is that with the 37 to 39, you actually get less pain with rewarming, and you really don't change the amount of time that needs rewarming. So if you still use the old standards, you're still going to get a good outcome. It's just going to be a lot more painful, and that's why all the civilian guidelines, Alaska guidelines, World Medical Society have gone to the lower numbers, 37 to